Hi, I'm Harris Harrington, creator of Depersonalizationrecovery.com. The topic of this video is alcoholism and depersonalization disorder, and why alcoholism makes depersonalization disorder so much worse and so much harder to deal with. So, a lot of people drink alcohol that have depersonalization. People that have depersonalization, derealization, oftentimes have very strong anxiety, and anxiety and depersonalization are really correlated. So when you drink alcohol, in the short term, it can actually lessen the symptoms of depersonalization disorder, the symptoms of derealization and anxiety, all kinds of anxiety. It can lower your social anxiety, it can make you feel more grounded in your body, and it can lower derealization and make you feel kind of more connected with the external environment. In the short term, alcohol can make you feel a bit better. The problem is when you withdraw. Okay, and I want to talk about withdrawal in two senses. There's short-term or acute withdrawal, otherwise known as a hangover. Okay, that's acute withdrawal. Then there's post-acute withdrawal or prolonged, protracted withdrawal from alcohol, which can last for 2 months, 6 months, a year. Sometimes it takes people over a year to feel normal again. So let's get to what alcohol does to you. Alcohol increases the chemical GABA in your brain, which makes you feel more calm, more centered. Alcohol kind of also turns on a lot of the reward circuitry, so serotonin, dopamine, all these chemicals that make you feel good, and particularly relaxed with GABA. So when you're drinking alcohol, you feel relaxed, okay? But the problem is when you try to get off of it, let's say the hangover, then you have less of that molecule in your brain and you feel even more anxiety. You feel the reverse of calm. You feel more anxious and you're going to feel more depersonalization. Hangovers can be some of the toughest moments for people with depersonalization. I mean, you can feel like you are going pretty much crazy when you're having a hangover. I mean, it can basically bring about full-on panic attacks. I mean, you really just feel super jittery. So the hangover is very tough. Now, you can always just drink more alcohol, right, to make yourself feel quote-unquote better. But if you drink alcohol for a prolonged period, let's say for months, right? If you've been drinking for months and you quit, then you're going to have to deal with not just the hangover, but the next week, the next 2 weeks, the next month. It could take you a while for your neurochemistry to readjust back to a good level. So if you're a person with depersonalization and you're on alcohol, then you can't just quit immediately. That's the thing with alcohol withdrawal. If you have a really high dependency, then you can't just quit immediately. That can be very bad. That can actually result in death if you're very dependent. I mean, you must be drinking 10 or more drinks every day or something like that. Very, very intense alcohol consumption requires a weaning off of the substance, not just cold turkey. You can't go cold turkey. But if you're a person who has depersonalization and you're thinking about alcohol, if you tried a little bit and you realize it kind of makes you feel better, I really kind of want to warn you that it's not a good path to go down. I mean, alcohol withdrawal can be hell. And it's very similar to benzodiazepine withdrawal. Benzodiazepine is a class of medication that acts somewhat similarly to alcohol in terms of activating GABA in your brain and making you feel relaxed. So with both benzodiazepines and alcohol, you develop a higher and higher tolerance. You need more of the drug to feel the same level you did before. And it's just something that's really can make recovery from depersonalization extremely hard. Okay, it can make it so much harder to recover. And it kind of goes hand in hand with caffeine consumption. I know, I used to drink caffeine to kind of boost my mood and kind of get me more up, and then I would use the alcohol to kind of bring that buzz down to kind of calm me down so I can get the 2, but it's like a seesaw roller coaster of chemicals. It's something you really have to eliminate. I mean, caffeine and alcohol consumption really have to go out the window together, and the withdrawal symptoms can be tough. I mean, you can feel depressed, you can feel angry, of course, more anxiety, more depersonalized, more derealized, just so cut off and numb, and just feel like you're in some sort of hell. So I really encourage you, if you're really dependent on alcohol, you got to withdraw slowly, and when you do get off, you should stay off. And you might need to consult a psychiatrist to help you out with that. Maybe you'll benefit from Alcoholics Anonymous, or just telling somebody and getting some support, because it can be really tough. So I hope this video helped. Stay tuned for more videos, and subscribe to this channel. Check out my website. And that's really all I have to say. Alcoholism can make depersonalization so much harder.